All right, it is that time. Right now, the NCLEX Critical Thinking Workshop begins. If you're 5 minutes early, you are on time. If you're on time, you late. And if you late, don't even bother showing up. This is the hottest place for nurses right now. Hey, I got International Nurses Day. This is your support. I'm also inviting repeat test takers because passing NCLEX is a universal goal for my Remar family, and I want to see you doing it. So honestly, I know we got some nursing students here, so this workshop will be for you too. Anyone taking NCLEX, tap in right now and let me know where you're from. I want to see what countries are represented here. Always so excited to have international nurses. Let's get it. Let's get it. So tonight we actually have two amazing opportunities. The first one will come from Grand Canyon University. And if you have the workbook downloaded, then you know they're offering you an amazing Remar nurse scholarship if you want to go back to school. How many people want to go back to school? RNs, you want to get that BSN, right? You want to get that MSN. I love my MSN. It's opened up so many doors for me. And you want to also get the DMP eventually. Well, Grand Canyon University has the Remar scholarship. Natty is the contact. Go ahead and give her a call. Just secure your spot with her now, because we have we're going to have thousands of people watching this, and you don't want to be behind the 8 ball. You want to contact Natty now. She's waiting for you. She's going to help you. All right. So we're going to hear from more from Natty at the end of this course. But I wanted to let you guys know that this is an amazing opportunity. Don't let it go by. So we are all about critical thinking tonight. Please get out your workbooks because we are going to jump right into it. Critical thinking. What is it? What is the benefit of coming here? What is the benefit of showing up? My name is Regina Callion, MSN RN, and I have been helping nursing students literally for over 10 years accomplish their goals of passing NCLEX. Shout out Trinidad and Tobago, Puerto Rico, Texas in the house, Qatar. I see you. So what are the benefits of attending a workshop like this? And this is where we will be filling in our workbooks. It's very important for you to have it. So the benefits of a critical thinking workshop for you as a nursing student is it's going to tell you how you should be approaching the NCLEX scenarios that you're getting. So, for example, you want to be able to solve these NCLEX problems quicker. You don't want to be in the testing center for a long experience, right? You also, as a nurse, as a test taker, as a repeat test taker, you have to be able to make better assessments. And a lot of the international nurses, you guys can say in your own country, you may not be doing assessments. That may not be something you do. But for NCLEX, you have to be able to carry out an assessment, not only in the physical, but also in your mind. You have to be able to do it in your mind. And so also recognizing your own bias. And this is a huge point. Yes, you have a prejudice to how you behave, your cultural preferences. You have a bias to how you think, what kind of treatments you prefer. And so you have to be able to recognize how that's going to affect your patient care and your treatment, the way you think treatment should be carried out. Yeah. And of course, this is all so that when this workshop is over, you guys can develop independent study skills. I don't want you to have a crutch or me or anybody else in order to be able to get the right question. I want you to be able to have your own independent study skills. So if that is what you are after, then this is what you are going to achieve here tonight. So I'm talking about critical thinking. I'm saying it's so important, but what is it? If somebody asked you what critical thinking was, what would you say? And so I want you to write down this definition. Critical thinking is actually, come on in, Belize, come on in, I see you. And share this video because a lot of people don't know that they need this workshop. And since you do, you have a responsibility to the other family members to let them know. Right now, over 1,000 nurses are watching this amazing opportunity. Share this video. So if I'm talking about critical thinking, what is happening is you analyzing the facts that you're given to form a judgment, and not just any judgment, right? Not just any judgment, but the right judgment. A lot of us can get it down to two examples. I should say a lot of us can get it down to two choices, and then we end up picking the wrong one. And I think that's the most painful scenario, because you have all the content in the world, but your content is not leading you to the right answer. All right. And so that is a problem that a lot of nursing students face. So when you have NCLEX in your mind and critical thinking, what you are able to do is you're required to understand the issues clearly. There's no confusion. There is no confusion when you are presented a patient with diabetes insipidus. There is no confusion when you have a patient that has type 2 diabetes mellitus, right? You understand that issue clearly front to back. And we're going to get into the case studies where you'll be able to demonstrate that. Also, this is the major secret. With critical thinking, you are able to ask the right questions. Critical thinking is not about having all the answers. It's about asking the question that's going to help you unfold where the scenario is going. They're talking about, for next generation NCLEX, preparing students for unfolding case studies. And those are all based on questions. All right. Every time you have an option, there's another question. So you have to be able to, 3, assess information accurately. That's the same as understanding it clearly. No confusion. Also, being able to arrive at the solution or the conclusion. That is going to evaluate if what you have been doing is really beneficial, or if you're a danger to the public, right? NCLEX is about keeping dangerous people out of the hospital or home health, my goodness, or nursing homes, right? So that is a very foundational. 5, remember I talked about your bias that you're bringing in. Everybody has them. Making sure that you are being open-minded, no matter what type of patient you have, right? No matter what gender they are, what sexuality they have, what religion, that you have to be open-minded when you're working with the public. Okay. Also, number 6 is to communicate effectively. Yes, communicate effectively. So come on in, tap in, share, write down, take notes. This is a ferocious class. I want you to understand that critical thinking is not intelligence. You don't have to be a genius to be able to make good decisions. Actually, if you think about it, a lot of the most brilliant people, their lives are jacked up because they cannot critical think. So take comfort in the fact you don't got to be book smart to be able to critically think, but you do got to have, what is the word? Common sense. Okay. You got to have common sense. So how can we critically think? Oh, it is so simple. It's about the questions. It is about the questions. So write this down, guys. We need to recognize the source. When you are presented with an NCLEX scenario, where is the information coming from? And I'm going to try to reinforce these ideologies for you guys, but you have to know, is the source coming from the patient? Is it coming from a family member? Where is the source coming from? Okay. And out of all of the information that you are given, what is necessary? Because everything is not necessary. Everything is not. All right. You have to figure out what is a distractor and what is needed. Also, 3, being able to formulate potential outcomes. And so what that means for you is you have to know the anatomy and physiology. You have to know the pathophysiology, and you have to know the medications and interventions. That is the process. All right. And so if you know those 3 categories, you are able to draw valid conclusions. Is that making sense? So it is really It is really a robust understanding of nursing. And that is why critical thinking is truly based on the content. Don't start just doing questions, right? And you think because you graduated from nursing school, you can just jump into NCLEX questions. Not so. Most of us will need an NCLEX review. Most of us will need a content review because there's just so much that's skipped over in nursing school. I'm not going to lie. There is so much that's skipped over in nursing school that your board exam will have, it will eat you up. It will eat you up very early on. So we have to be able to see it as it is, right? So let's look at our first case study. I told you guys, I'm getting right into it. We 7 minutes in, I'm giving you the first case study right now. Did you look over your worksheets today? So our patient that we have here today, is Donna Jones, right? And she has the diagnosis of obstructive bowel disease. Do you know what that is? So what information are we given? We know that all right, we're looking at orders. So the healthcare provider said this. They said morphine sulfate, 2 to 6 milligrams IV every 2 hours, PRN for pain. Just basic stuff. Do we know what morphine is, right? Do we know what PRN stands for? If you missed over that, if you don't know, you didn't use international nurses, if you didn't use, this kind of documentation, you gotta review it, okay? And so the healthcare provider says, give 2 milligrams for the first dose and reassess within 30 minutes. Now, when a healthcare provider gives orders, and this is what NCLEX is going to be testing you guys on, is what do you do when you have potential scenarios that allow you to think outside of the direct orders. So it says here, if adequate relief, reassess within the next 2 hours, right? If no side effects, but inadequate relief, may give 4 milligrams more in 30 minutes or when time to peak effect has passed from the first dose. So the total dose, therefore, is 6 milligrams in a 2-hour period. Woo, that is a lot. That's a mouthful. But do you understand what that healthcare provider is trying to tell you? Do you understand what you have to do? Okay. And so my question to you guys, and the first thing I want you to write down is this. What are 3 other effects that could happen to this client within 24 hours? Because guess what? This is all about the questions tonight. I'm asking the questions. I'm going to try to get you to free think as much as possible. Go ahead and put it in the comments because I have some things that that are effects that I thought about, and I'm going to share my critical thinking thoughts with you. But I also want you to share your comments and also your peers to share theirs so we can see what there's more than 3, but give me your 3, right? Give me your 3. What are the other effects that could happen to this client in 24 hours? And for me, when I show you my main effects, they are going to be they're going to be surrounded by potential disasters or complications, because I know that's where NCLEX could possibly be taking me. So you have your 3 down. Let me see what some of you guys have for, okay, I love it. Respiratory depression. Absolutely. I see it. Respiratory depression. So we're in agreement on that. Sedation, constipation, over medication, lethargy. Okay. So yeah, these are the ones that I have as well. I'm number 1 thinking of depressed respirations. Now you may be thinking, yeah, we know that. That's basic information. But if your client has depressed respirations, that also means that you're not going to be able to teach them. They're going to have a decreased level of consciousness. They're going to have a euphoric feeling, also constipation and dizziness. So depressed respirations come with a whole lot of interventions, right? If you give your patient morphine and you're giving them morphine on a regular basis, can you discharge them? Can you send them home? No. But NCLEX asks you questions like that. They will. And if you're not a critical thinking nurse, you will say, yes, I'm going to send this patient home. I'm going to do my discharge teaching because they don't have pain relief. I mean, they don't have pain anymore. They don't have pain anymore. So there's connections that go along with the side effects. And you guys have to be in a mentality of asking yourselves questions. So again, I want you to write down depressed respirations. You guys have that. Decreased level of consciousness. I saw some people with that. I did not see anybody say an inability to understand patient education. Nobody addressed that. So make sure that you correlate that with morphine. Euphoria, constipation, dizziness as well. And of course, nauseated. Yes, 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 yes. So when we are talking about nursing students and the way that they are thinking, it brought me to these two guys, and they're just two famous detectives, and I really liked the presentation of the two because the first one is a fictional detective. His name is Sherlock Holmes. Are you guys familiar with him? I know this is International Nurses Day, but I feel like my international nurses will be able to recognize Sherlock Holmes. He had a very systematic and analytical approach to the way he did things, right? And he used observation and logic and deduction. So he was very methodical. He was very prepared in how he was able to solve crimes. I want you guys to be like that. I want you guys to be like that. Whereas you have another inspector, Inspector Clouseau. Do you know him? He was known as the Pink Panther. And it was as if when he solved crimes, he was the nurse that does things by accident, right? So she bumps into the patient and realizes, oh, this patient doesn't have a leg, right? Or this patient is ready to eat and she realized, oh, this patient doesn't have any dentures in. So I want you guys to definitely have a prepared method and a rational thinking, a logical thinking in this critical thinking area. 2,000 nurses watching this review live. It's amazing, guys. Give yourselves a round of applause just for showing up on a Monday night. I love it. I love it. We are getting into critical thinking, and the next steps that we need to review are, what does it take to be a Sherlock Holmes? What does it take to be more adaptable? And if you have been following Next Generation NCLEX, you know that they have come up with the new clinical judgment measurement model. Oh my goodness. Yes, the clinical judgment measurement model. And so that is where all of our case studies will be coming from. And the steps to that model are essentially these three things. I mean, basically, these are the three things that I formulated them down to. Number one is we are considering the source, right? If we are getting information from our CNA as the nurse, what do we need to do? What do you need to do if the NCLEX scenario says that the CNA said your patient's blood pressure was 100/64, right? What do we need to do if the source is the patient? Do we just, I'll leave that for later. What do we do if the source that we're getting the information from is the family member? Is the family member? We need to consider the source. I need you guys to be just like how these scammers show up and they say, listen, I'm going to give you the key to the NCLEX. I'm going to you give me $3,000. I'm gonna take that test for you. People probably then gave away hundreds of dollars, right? Because they're not considering the source, right? And so we have to do that. And once we understand the facts that are presented, we need to formulate the hypothesis. And that is big for the clinical judgment measurement model. Wow, say that fast a couple times. You have to understand, what is the question? Hypothesis. Remember, we do it all the time. We did it a lot in chemistry. We did it in, where did we take biostatistics? My goodness, in nursing school. What were we doing? Making a hypothesis about what was going to happen. And we have to think through, like I said, we have to think through the issue from beginning to end objectively, taking out our bias. So we are going to stretch you a little bit with another case study. We're going to stretch you a little bit with another case study. And I love it. I love it. You said if the CNA gives you that information, you better go do those vitals again. You better assess that, reassess that information to be accurate. I love it. Yes, recheck. That's what we need to do. So here, how about this? How about this? And put the page that we're on right now for some people that come late, all right? Because we are deep into this thing. We're looking at, all right, why is critical thinking necessary? Why is critical thinking necessary? You have this patient here. Here he is. Jamal Jones, 62-year-old. He's a male. And what is his scenario? What is his situation? I'm going to read it to you for those of you who may not have your workbook here. But it says, so this client, he reports to the wellness nurse for a follow-up health visit. The client states he has been fully compliant with his diabetic diet. Okay. The client reports daily exercise in the form of jogging and stretching for 30 minutes. Okay. The client verbalizes improvement in his capillary glucose levels. This is what the nurse wrote. Now, upon my assessment, the client has gained 14 pounds in the last 2 months. The client appears to have 3 wounds on the right leg and 1 on the left foot. See the skin assessment form for more detail. The client's current capillary blood glucose level is 343. Dr. Kimball notified of findings, awaiting order, will continue to monitor. Okay, so you got that? You understand what we have in front of us? We got a self-report, right, from the patient here. So just based off of this one nurse's notes, all right, because I'm getting you guys ready for next gen NCLEX. What are you going to do? My question to you guys is, what critical thinking questions does the nurse need to ask? What critical thinking questions does the nurse need to ask? Write down at least 3 questions. I want to see you guys do this. I see the comments on the screen. Goodness, what critical thinking questions would you ask this patient? Because based on those questions, and listen, it's not about right now, it's not about right or wrong, right? It's not about right or wrong. It's about just doing it. Just doing it. Get out of your comfort zone. Don't wait for me to give you the answer. Based off of what I told you, what are your critical thinking questions? I have my own. I had a whole bunch. I just wrote down 3 though. I just wrote down 3. So what are your critical thinking? And I see here, what is his diet, right? He said he's following his diabetic diet. Oh no, non-compliant diabetes. When was your last meal, right? Because you got that blood sugar. Oh, these are so good. Yes, these are so good. And this is what I wanted in terms of sharing your comments. Remember, there's no bad answers. There's no bad answers here today. This is all about brainstorming. So my three critical thinking questions that I had were this. The client says that he has been following his diabetic diet. What is his understanding of the diabetic diet? Does he think that it's okay as long as he doesn't have cookies or cake, but he can still drink soda? You know, what is his understanding of the diet? Because when you look at the patient, you can say, well, you told me that you're exercising 30 minutes every day, but you gained 14 pounds. How, right? How is that possible? What medication is he taking? What medication? Are you taking your medications? Are you on a medication? Let me ask you guys this. What medication could he be taking or prescribed that could cause him to have that weight gain? Tell me right now, what medication? I have one in my mind, but I know you guys can help me think of some more. What medication could he be taking that's going to cause him to gain the weight? And let me go back here, because it says that the client states he's been fully compliant with his diabetic diet. They reports the daily exercise in the form of jogging and stretching. So we know that this client has diabetes. It doesn't say whether he has type 1 or type 2, but that doesn't matter because there are medications that will cause you to gain weight. And I'm looking for why. I see it there. I see it. Yes. You guys know it. Your prednisone is going to blow you up. Yep. Your prednisone, your steroids, your glipizide, that may do it. Your metformin can cause you to gain weight. Some people lose weight with it. What else do you guys have? Psych medications. Oh, yes. Also insulin, right? Insulin makes you gain weight. Insulin makes you gain weight. Perfect. So that is a question that you might want to know, right? And tell him you are on this medication. He could be retaining fluids, right? Is there a medication that would make him retain fluids that would cause the weight gain? All right. Also, you could ask him, this was my question before I cut myself off. Has he been sick? Why would that matter if he has been sick? Why would it matter if this patient has been sick? What do you guys think? Insulin. I'm looking at the other medications when I asked what would cause him to gain weight. Good thinking. Yes, good thinking. The steroids are going to really do it. Especially if they are ill as well. Any respiratory issues? Okay. What else do you guys say? Stress on the body. Yes. So that's going to, exactly. If your patient has been sick, then that's going to cause that blood sugar level to go up, right? And so this is all, guess what this all is? This is critical thinking, but what is it based off of? It's based off of your understanding. It's based off of your understanding of the pathophysiology. It's based off of you being able to form a hypothesis based off of all of this information. And some of it was not necessary to know, right? So the client has 3 wounds, right? That's interesting information, but you don't need to know that in order to determine that something is amiss here with this patient, right? So I want you guys to be able to critically think and do it in a speedy manner. Because when you overthink these scenarios, you end up, oh man, you end up spinning your wheels for a long time and giving up. So good job. All right. So, and so what happens when you're not able to put down really great questions like you guys just did, when you're not able to come up with really great questions? And this is what is happening. This is what's happening in practice today, and why the NCLEX is changing is because what nursing students, when you guys graduate, and I'm preaching to myself because I was like this as a new nurse, right? That's why I wrote first shift to help you guys not make the mistakes I made. Goodness gracious. When I was a new nurse, I really wasn't that great at critical thinking. And so I believed everything that my patient told me. The patient report was the patient report, right? It was where I got my facts from. And so that's what happens to nursing students who do not critically think. We believe everything that the patient tells us. We become like robots. All right. Looking for constant direction. We do not know how to, and if this is you, or if you know what I'm talking about, go ahead and co-sign. We become like robots. We are lost. We don't know how to prioritize our care. We are overwhelmed. Sometimes you feel like this in clinicals when you become a senior nursing student or even a junior. The teacher tells you to go give a bed bath, and you spend 30 minutes getting the stuff together to just give a bath. You are so overwhelmed, right? You don't know, what do I need? Water? Do I need towels? Do I need soap? You are unable to put one foot in front of the other and make a good decision. So this is what happens, right? And so also what happens is if you're not critically thinking, you're not going to be able to catch the changes in your client's condition, because those changes can be kind of subtle. You might miss them if you are not aware that the temperature has been elevated, or if the patient has said that they have been exercising, but then, they gain weight. It's tough. It's tough to catch those changes. And so what happens is the mortality rate goes up on a unit. Man, when COVID first hit, because there were so many new nurses on units, right? These COVID floors were new and established. There was a stress put on the nursing staff and the care of patients because the changes in the patient's conditions were happening so rapidly. And so we want to be able to stay in front of that. And also what's so important, and I keep going back to it, is being able to ask questions. You do not ask questions if you cannot critically think. And so, yes, this is very pertinent for you guys. This is very important for you guys to understand. And this is why I'm taking time out of my schedule in order to make this happen. Okay, you have to be able to be free thinkers. All right, you guys are so smart. You're so smart. You have to be able to ask great questions. And so I want you to stay away from the nurses because some of this is ingrained, right? Some of this is prohibitive because of what we see on the floor, right? So we have to stay away from nurses who say this. I have always done it this way. My goodness, whew. The nurses that don't wear gloves when they start in the IV. Oh man, the CNAs who don't want to take direction from you, right? And so CNAs, LPNs, RNs, they all struggle with not wanting to change. And so we have to be able to accept new teachings, accept new treatment plans, and keep studying, right? This is the way my preceptor taught me. I didn't really have too much to say about that, right? We have to be able to be free thinkers. And I can't keep up with all the policy changes. People will say, there's so much new things out there. How can one know what is the newest thing? All right, that's your responsibility as a licensed practitioner. That's why we have CEUs. So critical thinking is an active and it is a daily thing that must take place. It must take place. So I want you guys in your minds, in your hearts, I want you to be thinking this and write this down. Write this down. All right. Why? Asking this question. Why are we doing it this way? Why are we doing it this way? What do others say about it? Okay. I may like it this way, but what are other people saying about it? What is somebody of a cultural difference? What do they say about it? And I love that you guys are being transparent. Listen, that's true. That's me. I'm guilty of that. Right. You're supposed to have everything ready. You guys must be talking about getting that bed bath stuff together. I've been there. And then, is there a better way? Is there a better way? So come on in, guys. Come on in. This is Remar Review. This is my critical thinking workshop. Welcome, welcome, welcome. I want you guys here. And we're about to jump into another case study. Your brains are warmed up. I'm hitting you with the case studies, and I'm doing it at a pace that is going to challenge you. So let's get into it. Tap in. So we have this. A client in the second trimester of pregnancy is being assessed at the healthcare clinic. The nurse performing the assessment notes that the fetal heart rate is 100 beats per minute with normal activity. Okay. All right. So I have 2 boxes on your worksheet. I'm going to take a minute because I want you guys to write down, and this is critical thinking, write down what you need to know about this scenario, and then write down what you're given. Okay, so let's focus on what you need to know. Okay, what is missing from here that is important for you? Okay, what is missing from here? What would you like to know if you could have any more information? Okay, it's about questions. It's about questions tonight. Good questions. What do you guys have? Somebody is saying, I want to know the diet. Somebody said, what is the normal fetal heart rate? Okay, perfect. And look, this may not be stuff that you know, and you're just keeping it real. You want to know the mom's vital signs. The trimester. Okay, we got the second trimester. So what is it you want to know? The patient's age, the patient's weight. Okay. Some people are putting down the answers to people's questions, right? So what is it that you need to know? A lot of things you can have. And then, so what are you given? What are you given? And you're not given much, but you're given enough. You're given enough to address the scenario. All right. You're given enough to address the scenario. So this is my, this is what I did. This is what I had down. I said, what you need to know. I put, why is she there? That's what I want to know. What are you here for? All right. Second trimester. Is this a routine visit or not? You do have routine visits. You do have routine visits, and you should know that. You should know that schedule. You should know that schedule. It's definitely in the virtual trainer. Are the assessment findings normal? I need to know. Are they normal? And also, at the end of all of this, what are you responsible for? Oh my goodness. What is your responsibility here? Are you supposed to do anything? Okay. People are saying, what week gestation is she? Says second trimester. Any discharge? What kind of medication is the mom on? What you need to know. Okay. And then also, what are you given? So we are basically just given that this is the second trimester and that fetal heart rate is 100. That's it. That's all we're given. So yeah, we don't know if she's on medication or not, but even if she was, is this a good thing? Is this something that we are looking forward to caring for? Is this the patient that we are just going to hook up on the monitor and let her rest all night, right? Or does this patient need something? So are we all together on this? You guys have all this written down? This is important. This is important. So the question here is this: which action would be most appropriate for this client? Is it number one, continue to perform the setup for an amniocentesis? What's the benefit of that? All right. Is that going to help? Is that going to tell us something that we need to know? Is it two, inform the mother of results and document the findings? 3, notify the healthcare provider. Or 4, what's most appropriate, document the findings first for collaborative communication. All right. And so these are all possibilities, right? These are all possibilities, but only one. And that's the thing about NCLEX. All of them could seem right, but there's only one that's most right. And that's what makes it so challenging, man. So which one is most right? Which one is most appropriate? And I'm glad I went over this. I thought this question might be too easy, but actually I'm having some mixed options. So I see people getting it down to 2, going to the most popular choices are 3 and 4. And some are picking 3 and some are picking 4. Some person says, I'm between 2 and 4. Okay. So this is an important question to go over. The correct answer, you all, is going to be absolutely number 3. Absolutely number 3. Okay. The distractor that I wrote was document the findings, and I put in a word. What word did I put in to convince the person that was not secure? What word did I put in there that was a total distractor and unnecessary? Okay. I put in the word, write it down. Yeah. I put in that word first. So nah, that ain't going to be it. Right. The fetal heart rate should be between 120 and 160 beats per minute during pregnancy. A fetal heart rate of 100 beats per minute would require that the physician be notified immediately. Got to call the physician first, and you're not going to chart. Okay. You're not going to chart anything first. You need to let that doctor know. Right. And I like that. Tania, did I say it right? I was taught that you need to do what saves the patient's life first. Okay. And that is so true. We need to have something to do, and we can't do anything as nurses without a what. There's not much we can do, especially in pregnant clients, without a physician's order. We have to take care of them very gently. So we need that order. If you didn't get that right, it's okay. I'm glad you're here. It's not about being perfect here. It's just about showing up. All right. Because if you get this question on NCLEX, you won't get it wrong. Let's look at another case study. Let me see. Yeah, let's look at another case study. Let me see here. Okay. Case study number 2. A nurse is caring for a child whose parents are mandated for a physical evaluation. Let's go. We're moving on. The parent's primary report to the nurse is the child has frequent temper tantrums that they are unable to control. The child is 3 years of age and notably afraid. So what do we need to know? What are you writing down in that box? What do we need to know? We got a nurse is caring for a child whose parents, they're mandated for a physical evaluation. The parents say this child has a problem with temper tantrums. What do you want to know about it? What do you want to know? Put the comments on the screen. I want to read them. I want to read them out loud. So we want to know, is there any abuse? We want to know, can the child speak? Okay. We want to know, how long has this been happening? Yes. Any changes at home? I love that one. Could the child be autistic, right? The milestones of the child. What happened? How did he get hurt, right? So that's what we might want to know. What are we given? We are not given much here for the first part of the scenario. We're not given too much. So this is what I had, and some of you guys are doing really well. So what you need to know is the normal toddler milestones, right? The normal toddler milestones. You got to know that developmental milestone for infants up to like teenagers, right? You have to know that. And so if you're not committed to studying that, these kind of questions are going to be very hard for you. I had a tough time with this subject when I was in nursing school because I don't particularly like pediatrics nursing. So this was a chore for me. Some of you guys may love it. You love the NICU, the maternity. God bless y'all. But you got to know the developmental milestones. So you have to know what's normal. Also, when you talk about toddlers and tantrums, what is the best advice to give to parents concerning that? Because that's what the parents are asking you about. Even though these parents got a lot going on, they bringing up temper tantrums. So you got to be able to speak to them where they are while you do your own in assessments as well, right? So what you're given about these parents is that they're mandated for a physical evaluation. Did that stick out to anybody? Did that stick out? That mandated is like a court order to bring your child in. Did anybody notice that? The toddler is having tantrums, but there's nothing else that's noted right there after that. So those were the questions that I came up with. Are yours similar? If the child is afraid, it's probably abuse. Yeah. All right. So the first question is this. The nurse instructs the parents regarding the appropriate action to take when the toddler has a temper tantrum, right? Which statement by the parents indicate a successful outcome of the teaching? And so each statement starts with I will. I didn't have a lot of room, but on your workbooks, you'll see the I will. So is it number 1, we're talking about temper tantrum teachings. So what is a successful outcome? What indicates the parents get it? Is it I will send child to a room alone for 10 minutes after tantrums? I will reward child with candy at the end of day without tantrum. I will give frequent reminders that bad children have tantrums. Or is it 4, I will ignore the tantrums as long as there is no physical danger? Which one is going to be the most appropriate Shout out, guys. I cannot believe that there are over 2,500 nurses right now studying all over the world. My mind is blown right now. I am so proud of this group right here. A lot of you guys are sticking with number 4. I will ignore the tantrum as long as there is no physical danger. Love that. Yep, I got to agree with you guys. This is going to be the best way to deal with a temper tantrum. And just so you know, you never want to reward with candy, right, or sweets for behavior. It sets up poor dietary principles and habits. Also, if we are talking about reminders or negative connotations like bad children, we got to stay away from that. The toddlers, they don't really understand reasoning. So you got to ignore them because they will understand that. They will understand that. Okay. So this is the next level to it because we're given some more information. So remember, we thought the parents were a little. My daughter Salome, she says they're a little sus, right? So the parents are a little sus here, right? They're a little suspect, and the nurse notices that while within the father's arm, the child looks down and refuses to make eye contact. Upon a height assessment, where the child has to stand up, the child is unable to bear weight on the left leg. So the femur appears to have a bruise. Which of the following medical interventions are most appropriate here? So this is some critical thinking. What do you need to do as the nurse? Oh, should I give too much away? Let me just see what you guys are saying. This is a select all that apply. What medical interventions are you going to do? And remember, what I'll say about this is you're not going to do everything. You're not going to do everything. You have to be really selective about the interventions because you don't want to trigger these parents, right? Too early. You want to be able to spend as much time with that child as possible. So out of the options that we have here, what are you going to do for these sus parents, right? Is it number 1, a complete blood count, skeletal survey, PT, PTT? Do we need to start this child on 1,000 milliliters of lactate ringer at 85 milliliters per hour? Okay, why would we do that? What's the importance of that? And then also, do we have a need for an MRI of the soft tissues? Wow. All right. So I love this question because this is critical thinking. This is also content based because you got to know what each one of these are in relationship, not only what they are, but what they are in regards to child abuse. How can you relate them? How can you create a hypothesis? Remember, I talked about it. How can you create a question based off of child abuse for the complete blood count? What are you going to be looking for? What are you going to be looking for? Very, very important. All right. And so I am going to give you the answers. I think some of you guys got it right. And I'm searching through, making sure I give people time to critically think. The correct answers, though, are this. They are going to be the complete blood count. You need to know that about the patient, right? You want to know, is the patient, are they anemic, right? Do they have any, and it goes along with the PT and PTT, do they have any bleeding disorders? Because if your child has a bleeding disorder, will they have bruises on them, right? Will they have bruises on them? Absolutely. Does that mean that the child is being physically abused? No. And you better be able to present that in a way that is non-accusatory to a patient. Okay, because as a nurse, if I come in there knowing that my child has a bleeding disorder and you call, CPS on me, I'm going to be very upset. All right. So the complete blood count, the skeletal survey is going to be important because you want to look for broken bones as well, any joint deformities. So the skeletal survey, and it's something that you can do that is pretty, what can I say? It's something that you can do that's pretty quick. right? It's pretty quick, and it's going to give you a good picture of what's going on with the child. We would not do an MRI of the soft tissues. A lot of people pick that, but remember, what is it about MRIs that don't make them child friendly? Especially if you don't have a real concern, and you need to know this immediately. Remember, MRIs, they're very long, right? They're very long. Some of them are an hour, and you have, my goodness, you have a toddler in an MRI machine. My goodness, right? So think about the distress that's going to cause. It's not going to work. And then there's no reason to start an invasive procedure with the lactated ringer. We're not trying to correct dehydration at this time. So it's not going to be, yes, they're very loud too, the noise. I didn't think about that. Yes, they're very loud. There's no indication that dehydration is a concern. They're closed in, they're very loud. Yeah. So a lot of people did pick number 5. So just cross that out of your mind, delete that. We're not going to go for that. Next question that I have for you all is this: which of the following are objective examples of physical abuse? Which of the following are objective examples of physical abuse? And we got a select all that apply again. I love it. Are they going to be number 1, delay in seeking medical care? 2, child does not turn to caregiver for comfort. 3, handprints on the skin. 4, Mongolian spots. 5, bruises in various stages of healing. Let's go, guys. I want to see these. I want to see y'all coming for these select all that apply questions. I need y'all to know them. I need y'all to love them. You have to fall in love with these questions and be ready for them, because at the end of the day, you guys know this stuff. You know this stuff. You know how it works, right? So what are we talking about? Listen, let me tell you this. If you can read, you can succeed. I'm going to say that again, because some people, you slow, but you worth waiting on. If you can read, you can indeed succeed. I'm preaching tonight because I'm looking for objective examples. All right. So when I say objective examples, that means things that are confirmed with facts. I'm not talking about nobody's opinion, right? I'm not talking about feelings. I'm literally talking about things that I can witness, things that I can validate. So the correct answer, I saw a lot of things on the screen. Number 1 is not an example of physical abuse. Delay in seeking medical care is an example of what? It is an example of neglect. And we're talking about physical abuse, right? So not number 1. That was a tricky one. 2 is an example. It is a physical sign. It is an objective sign. You can see that when a child is in distress, they do not run to their mother. They go in a corner, right? They go in a corner to be alone to find comfort. This is very abnormal for a toddler. My 1-year-old is all over me all the time looking for comfort, right? And so you guys know that too as mothers. We don't get a break. We are the comforter. So if a child does not turn to their caregiver for comfort, that is a physical sign. 3, handprints on the skin. 3 should also be tokenized as well. I apologize for that. I'm gonna blame Mark on that. Mark, 3 should also be handprints on the skin is definitely an indication of physical abuse. And Mongolian spots is not. Mongolian spots is very common, and it is normal, especially with what kind of patients? What kind of patients do we expect to see having Mongolian spots? So if you're not sure, I want you to put a star by that and look it up. So the next correct answer is 5, bruises, right? Bruises in various stages of healing. Okay. So the correct answers here again are going to be 2, 3 should also be highlighted, and 5. 2, 3, and 5. Are we all clear on that? All right. And I'm really proud of my nursing students who some of y'all are not even in nursing school, but you let me know I'm coming to this thing because it's hot. And this is a topic I want to be ahead of. So come on in. All right. So let's go on to our next case study. This is how we are critical thinking today. So we have another scenario. I like this one. So Jody Grant is admitted to the emergency department with a diagnosis of heart failure. She was discharged from the hospital 8 days ago and states her legs weigh 100 pounds and she can't catch her breath. The nurse learns that the client is following her fluid restriction and low sodium diet appropriately. She reports gaining 1 pound per day since discharge. So we have the two boxes here. What is it? What do we need to know? And then what we are given. Okay. So I'm going to give you my questions and you guys can put yours on the screen, but for the sake of time, I'm going to give you my questions, right? And here's my questions. What you need to know. So about this patient, because we're seeing them gain weight and she's saying that her legs weigh 100 pounds. I want to know what meds is she prescribed? What meds are prescribed for the patient? Okay. Also, does she know how to take the medications? Just because a medication is prescribed, sometimes patients don't know how frequently they should be taking them. Okay. And then also, I wanted to know the oxygenation status of this patient because the patient has some signs, and you guys may already be knowing what I'm thinking of. I'm going to go back to that in a second, but it says that her legs weigh 100 pounds and she can't catch her breath. So what am I thinking already? Yes, I see it on the screen. You guys are with me. So that's what I want to know about the patient. Yeah, I want to know that about the patient. And then what I'm given that she does have a cardiac history. Mm-hmm. And of course, there is a diagnosis of fluid overload. That's important to me. And why the current regimen that she is on, for whatever reason, is not working. It's not working for this patient. So these are the things that I want to know. And these are the things that I was given. So my first question to you guys about this patient, let's go, is this, what error in teaching most likely occurred? Come on, keep up. What error in teaching most likely occurred here with this patient? Somebody that comes in with these signs, they are, what does it say? They're following the fluid restriction and the low sodium diet, right? So they're following that diet appropriately, but they're still having these issues. So the error in teaching that most likely occurred, I love it. Yes, it is that medication error. Exactly. It is the medication error. There's something about that is not effective. So what do we do now? So I want you guys to look over the medication orders that the doctor has prescribed here. We're gonna just talk about these medications, and you're filling in the blanks because I left some of these medications blank, I believe. So the current medication that the patient is on, we got enalapril. And remember, when we are studying medications for NCLEX, we are looking at generic names. No trade names, international nurses. No trade names, repeat test takers, okay? New nurses, we need to know the generic names. So also she's on carvedilol. What kind of medication is that when you see the law? Glipizide and furosemide. All right, you got to know these medications. And the furosemide order is furosemide 80 milligrams IV push, then 40 milligrams a day IV push. And guys, these are not, I didn't say these were her home medications. I said these are her medications. So assume that when she came in for treatment, that the doctor wrote these orders. It says healthcare providers orders. So assume that they're writing these orders for her now. Okay. Because that's what we're going to be talking about. Okay. So here we go. There is the first question. You guys have all these medications written down. So the first question is this. Come on with it. I'm looking for my 5-star nurses. Before administering medication, which question should the nurse ask? Come on. I want everybody to write it down at the same time. Before giving any of these medications, what do we need to know? All right. My senior nurses, help my new nurses out here. We need to know. Let me see if you guys have it. Facebook, YouTube, who has it first? The blood pressure. No, it's not the blood pressure. The 5 rights. Yeah, I'm thinking of allergies. So yeah, allergies. We need to know if the patient has any known drug allergies. Amazing. Yep. Just as simple as that. Okay. Now, here's my next question. When I'm looking at the furosemide, I noticed that the amount is changed after the first dose. Why is that? Why is the furosemide 80 milligrams IV push and then 40 milligrams after that? Why would they need to do that? What's the purpose of that? Because you have to be able to ask yourself questions. If you didn't ask yourself that question when you wrote it down, then I'm giving you a perspective. Okay. Why would we do that? Somebody says loading dose, blood pressure. Good job. Yeah, exactly. I'm grateful. I'm grateful you guys are being transparent and putting these comments down. This class would be super long if nobody was commenting. Okay. And so exactly. It's a loading dose, jump started. I like that. With furosemide, because it's such a powerful diuretic, the highest dose is indeed given in the beginning of treatment. It's given in the beginning of the treatment. So yeah, let's do it. Let's move on. So we're talking about furosemide. So what are 3 parameters that are used to monitor the effectiveness of the furosemide? That I'm asking you guys to tell me if you administered this patient, what's the patient's name? If we administered this patient this furosemide, Jody Grant, what are 3 ways we're going to determine if it is effective? Are we going to look at, some people are saying blood pressure. Okay. But what is the main function of furosemide? Why are we giving it? Okay. Electrolytes. Okay. We're looking at the effectiveness of the furosemide. So we're going to be monitoring, and these are my things. I see ionos. I definitely see that. So I have here daily weight. I think I've seen somebody put that. Daily weight, the edema, right? We're going to look at the location and the qualities because that's what we're giving. That is what we're giving this furosemide for. Furosemide is a diuretic. So that's going to be the first thing that we're going to be monitoring to determine if it's effective or not. As if it's not effective, then we need to do something else. We need to do something stronger. So I want you guys to think of, in your minds, you don't have to tell me, but in your minds, what medication is that bump up? What medication is that bump up after furosemide that we can give? It's a little bit stronger. We also, write this down, are going to be looking at intake and output, ionos. You guys said that. And then the electrolytes. Yes, the electrolytes. We're on the same page about that, particularly the potassium and magnesium. We could also look at the BUN. I didn't put that down. BUN and creatinine too. But those are the parameters that we are going to be monitoring. So we have this patient, right? You have her treatment. You know what kind of history she has. Let me ask you this. This is critical thinking again. So upon further assessment, this patient, it's not even a further assessment because we know this patient has systemic congestion. What does that mean? So the nurse should expect which kind of congestive heart failure? Okay. Which kind of congestive heart failure? I'm looking for I'm looking for a category of congestive heart failures. And my nurses who are on it are on it. Okay. My nurses who are on it are on it. What side? What side? Yes. Ooh. What side? The correct answer is going to be, yes, the right side. The right side. Oh my goodness. You guys are studying hard. You are making the connection. Listen. We got 2 more case studies, but I want to take a little interlude to tell you guys about the amazing opportunity for my REMAR nurses with the scholarship, with my international nurses. We are looking at your transcripts. Grand Canyon University, they have figured it out and made it super simple for you guys to go back to school. So I'm gonna let Natty tell you more about it. I hope you're enjoying our International Nurses event. I am so excited to be here with Natty from Grand Canyon University, and we are talking about how education is power. Sometimes it can be difficult for international nurses to continue their education once they're in the United States. So can you talk about the benefits of why our international nurses would need to take the next step to advance their education?
Of course, take the next step to advance your education is going to mean career growth. It's going to benefit you, it's going to benefit your family, you're going to be able to give back to your community, you're going to be able to give back to your hospital, long-term care facility, wherever you have a passion in healthcare, and it is just going to springboard your career. If you're looking for a bachelor's degree, if you're looking for a master's degree, a DNP or nurse practitioner, Grand Canyon University can help get you there.
So what's the first step that our nurses should take if they're like, yes, that's me, I want to get more education to be a better, more marketable nurse?
The first step is to call me so I can help you complete your GCU student application free of charge, as well as for my international nurses, I can complete a complimentary foreign evaluation with unofficial transcripts.
Wait, so did you guys catch that? She said, give her a call. There is no cost for her to help you get started with your application and also go over your paperwork. That is amazing. Mm-hmm. So what is the number that they should call?
You can call me at 813-285-9377. You can call, you can text. So again, it's 813-285-9377.
Oh my goodness, this is an amazing opportunity. I hope you guys don't let it pass you by. Our International Nurses event is more than just passing NCLEX. It is making sure that you end up not only with your NCLEX pass and your nursing license, but the career of your dreams. And so we are happy to be here with Grand Canyon University. Remember, guys, you can, you will, and you must pass NCLEX. So again, Natty is the contact. Her number is in your workbook, but also just take a screenshot of this slide so you can call her, text her. I believe she is on standby right now for you guys. We had nurses during RNU who signed up with Grand Canyon University, got the scholarship, international nurses from Nigeria, Jamaica. They are in school right now. They are in school getting that BSN. You guys know that when you talk about taking your nursing career to the next level, that advanced degree, so worth it. It's so worth it. So give Natty a call. Tell her you are down to go to school and you want that REMAR nurse scholarship because she is going to help you register for school. I mean, and it's different when you just are doing it alone, but when you have somebody that is like, okay, this is what we're going to do. I'm going to call you. We're going to go over the paperwork. I'm going to call you. We're going to register. Having that person to hold your hand makes your success more likely than doing it on your own. So if you've been trying to do it on your own, wanting to go back to school, can't get started. And the great thing about it is that the campus and the course is online. So you can take it anywhere. You can get the REMAR Nurse Scholarship from wherever you are because it's an online program. And they do have the physical traditional school if you want to, but if you want to do it online, this is the great option to take advantage of that. So give her a text. Don't wait to the last minute. Do it now. Just let her know. Give her your name, your email. Tell her this is what I want. I need help. I want to connect with you. All right. Thanks, Natty, so much for taking care of our nurses, our international nurses. We are looking forward to many more testimonials. Okay, we are going to jump back in. We are going to jump back into case study number 4. Case study number 4, and I'm loving these patients tonight. I really am. Greg Hayes is a 37-year-old man, and he is having difficulty breathing and presents to the emergency department, right? He reports chest tightness, dizziness, sweating, nausea. He has some numbness, right? And very scared, very scared. Okay, feelings of impending doom. He states, "I don't think I am going to make it. I'm having a heart attack." Mr. Hayes' hands are trembling. They're trembling. We get some more information about it. What are you guys thinking is going on with this patient? So the vital signs are this. 175 over 93. That's the blood pressure. Heart rate is elevated. It's 101 slightly. Respirations are 26, and the temperature is 98.6. Oh, wow. Okay. And we found out some more information. The client was giving a work presentation when the symptoms began. He reported this event has happened to him 3 times in the last week. This client don't have any significant cardiac history. Okay. Any significant cardiac history. Okay. So we're on this case study. Listen, I see your questions there, and you want to go back to school. The best thing for you to do is contact Natty. All right. Let her tell you. The program that we are talking about is for RNs. If you're studying for your NCLEX RN and you want to go back for the BSN, right? Or you want to go for your master's, and this is, you want to call Natty. All right. So I see you guys getting back to the case study. I see you guys putting up your thoughts about this patient. What's going on with them? So I did ask the question, what you need to know and what you are given. What you need to know and what you are given. And what you guys are saying is this. What you want to know is the client's oxygenation affected? Okay. Is the client's oxygenation affected? That's not given to us, but we want to know that. Also, want to know the labs. What is going on with this patient? I want to know what kind of labs are important when you have a patient that's presenting like this. He said he's having chest pain. What labs are important to me? And this is asking the right questions. All I'm doing is asking you guys questions. You see that? I'm asking you questions to make you think. Oh, I like that. How long did the pain last? Describe the pain. I didn't even put that down. And then there's no cardiac history. What other history is there? What do you mean? Right? I like that. Troponin, CKMB. All right. And so what we're given is that the client has shortness of breath. All right. The difficulty breathing. They're having chest pain, and he says he's having a heart attack. But how does he know? You don't have no history, no cardiac history. How do you know? Right? And so that goes back to believing everything the patient says. So my first question is, if this was true and you guys already started this, what are 5 initial interventions? What are 5 initial interventions based off of this client's pattern and behavior? What are we worried about? And I can just probably agree what I've been reading off. We need an O2 saturation. We need to know if this chest pain that he's having is truly affecting the oxygenation, his systemic oxygenation level. I need an EKG. I need an EKG stat, like Adrian says, EKG for this patient. Blood draws, troponin level. Laura, troponin level said that. So I want to know that. I want a portable chest x-ray. Why would I want a portable chest x-ray? What am I worried about here significantly that'll be very, very dangerous if this patient has this issue? I need to know immediately. And the chest x-ray is going to show me that. What am I getting a chest x-ray for? And it's what patients, if you come in there with chest pain, the doctor is going to order that, because they're not going to be looking for an enlarged heart. I like that. Blockage, a PE. Yeah, Christine says a PE. Shout out Facebook. Yep. Okay, PE. and I need an IV line. I need an IV line because you might, if it is a myocardial infarction, I might have to give some cardiac medications. I might have to give nitroglycerin. There are so many things that I might need to give this patient. So establishing an IV line. Those are my 5 interventions. You guys may have had some good ones. Those are mine that I wanted to share with you guys. So this is the medication that the doctor actually orders. You know this one? The doctor actually orders Lorazepam, 1 milligram IV push. So what do you know about this medication? After the medication is administered, then the shortness of breath resolves itself. So what is the most likely condition of Mr. Hayes? Based off of this, the most likely condition of Mr. Hayes, after the Lorazepam is given, he's fine. Everything is cool. What is it? Good thinking. Some of you guys had already, before I gave you the medication, you already had put it in the comments. And of course, we know that Mr. here is having anxiety. Okay. He's having these frequent episodes at work, something about his job, something about him doing these presentations are causing him to feel out of control and producing these panic attacks or anxiety. So you have to be able to use your questions to be able to differentiate the myocardial infarction to the angina to the panic attack. Okay. Yeah. You guys got that. Yep. All right. And this is a question about the medication. I just wanted to ask you guys. So after you get the order for Lorazepam, you realize that it's a short-term medication. Why is this a short-term medication? Meaning, why can we not promote Lorazepam as a lifelong treatment for anxiety? What is the issue with Lorazepam? What do you guys know about it? I want to see that. And this is how you make the connections with pharmacology to pathophysiology, because we went from talking about MI laboratories, PEs. Now we're talking about Lorazepam and why we need to not give it for the rest of his life. And it is because it's highly addictive, right? It is a benzodiazepine. Dinora, absolutely. It's a benzodiazepine. And so this medication may be habit forming. Okay. All right, guys, we have been studying for over an hour and you guys are still coming strong. This is the kind of energy I need you to bring to your actual exam. Let's pretend like we are in that room. We are laser focused. We're not leaving without our license. This is our case study number 5. Miss Peterson is an 83-year-old client. She was admitted last night with a diagnosis of syncope and change in mental status. She has a history of hypertension, Siadh, changes in mental status. She lives alone 10 minutes away from her daughter. Miss Peterson was found on the floor by her daughter. She was there for an unknown amount of time. Okay. Got an older client. She has a lot of issues. My question is here. First of all, what data is missing? These are the things that I found that I wanted to know more of. What did you want to know more of about her? What would you want to know more of? I want to know. Give me some assessment findings of her, right? What I see this client. Is this client supposed to have on glasses? Does this client wear a hearing aid? I need to know, okay? I want to know my assessment. I want to know the psychosocial history. What do you mean changes in mental status? What is going on? Does this patient have dementia? Is this temporary? Is this a urinary tract infection? What do you guys think? What do you want to know about this patient? Did she take her medication? Did she fall? What are her vitals? Right? Does she have a vision issue? Yes. Okay. Yeah. Rhabdomyolysis. Ouch. That hurts. Right. Also the medical treatments. Yeah. Is it a UTI? What medication is she taking? Is she on a benzodiazepine? We know what that does to the elderly. Is she dehydrated? Right. So that's the information that was missing. Let's see if we can let's see if we can, based off of what we're given, I want you guys to tell me right here, does Miss Peterson require the following based off of what you're given? All right. And share this video. There's some people that will jump on this thing and they will watch it tonight when they get off of work or in the morning, wherever they are. I want them to be able to have this training. So share this video, smash that share button for me. So based off the information, does Miss Peterson require oxygen? What do you guys think? The cardiac monitoring, would you do that for this patient? Would you get an IV pump going? Would you do an indwelling catheter, right? What is the purpose of the indwelling catheter? And would you do restricted activity for Miss Peterson? What would you do? All right. Critical thinking questions right here. I'm going to tell you, people are like, yes, I would not. All right. So the correct answer for Miss Peterson, let's see if I have them all right here. So oxygen, yes, because she has some coronary artery disease, right? And that may affect her oxygenation, even though I'm not too sure what it is, but there's some mental status changes and sometimes a decreased level of consciousness will affect your oxygen. Cardiac monitoring, yes, I would, because of the history of hypertension. So I want to know. Would I do an IV pump? I hope you guys thought yes for that, because with syncope, sometimes that is a result of the blood pressure being kind of low. And so IV fluid is what is used to increase the blood pressure. All right. You can also give vasopressin as well, but that is not a choice here. So IV pump I would have. The indwelling catheter, I would not. And the only reason why is because I could do something else before I put in a catheter in. A catheter is going to put my client at risk for a UTI. I would not want to do that. I could put a diaper on her. I could get a bedside commode. And we have to think about that, because for NCLEX, CODIs, right? These urinary tract infections that are caught on the unit, they are so frowned upon. Right? They're so frowned upon. And it happens when we give patients indwelling catheters and we're not checking them and we're not really making sure they're appropriate. So I would not do the indwelling catheter for this patient. And the restricted activity I would do. The patient would have bed rest or walking with assistance. Okay. All right. That's my rationale for that thing. The next question here is, yes, the hospitals pay for the UTIs. Exactly. What are 3 sources to retrieve missing information based off of this client presentation? What are the 3 sources that you're going to get your information from? Go ahead and tell me that. We talked about being able to ascertain the facts. So who has the facts? Who has the facts? That is going to be, you see, does have anybody have it? Yes. So we're going to have the patient. You can ask the patient. There are things this patient knows. You can also ask the daughter and then also check the medical records. Okay. All right. And thinking about Miss Peterson, what is the pertinent legal question that the nurse must ask? I'm taking y'all to the legal aspects of nursing. What does the nurse need to know? Come on. What is the legal question? It's super important. It's very important. Let's see. Did you guys get it? It is, I like that, DNR. It's actually the power of attorney. Absolutely. Does the patient have a durable power of attorney? That is going to be so important. That's going to be so important. So make sure that you understand the principles of a living will and a durable power of attorney. Okay. All right. So the nurse, we're talking about Miss Peterson. The nurse receives the following orders. The client, hey, they had orthostatic hypotension. So that is what the issue was. The medications that they are to administer, lisinopril, 10 milligrams. We know that. MVI. I hope you guys know MVI. That's a multivitamin. Lovenox and Colace. Very popular two medications. So they get these. So the question is, orthostatic hypotension, what factors place Miss Peterson at risk for this diagnosis? What factors are going to place Miss Peterson at risk for this diagnosis, right? So orthostatic hypotension, how do patients get this? What is it? Yeah. Yes. Mm-hmm. It's pretty common. It's pretty common, actually. And you guys are all correct. Her age, her hypertension history, because typically if you are having issues with hypertension, you're on a medication. And so that medication, yep, you overdose on that medication because your liver, as you grow older, slows down. And also the mental status change, right? That puts you at risk for orthostatic hypotension. You get up so quickly. So you get dizzy, right? All right. So that was our case studies. Now I want you guys to understand this. We have done a lot of work. We have done a lot of work in a small amount of time, but there's still more because I'm going to take you into the virtual trainer. But honestly, these are the easy mistakes. And I say easy because they're easy to be corrected. These are the mistakes that really kill critical thinking. And I've seen it here tonight. So number one, write it down, not knowing your laboratory values. Not knowing lab values. And I don't mean just like the numbers, but I mean understanding what the importance of them are, right? So how lab values relate to diseases. That's what you need to know. Why do you care about the BUN and the creatinine? You don't just care about the numbers. What do they indicate? If a patient has a hemoglobin that is very low, what does that mean? If a patient has a albumin level, what does albumin indicate? All right, so you have to know that. Not knowing normal vital signs. When we talked about the pediatric patient or we talked about the infant in the second trimester, you got to know the normal vital signs, the content. And I'm not just talking about your favorite subjects or what was on your nursing exams in school. You need to know a foundational as well as a robust content, okay? Oh, test anxiety. Test anxiety, you can know all the content in the world, but if you cannot overcome your test anxiety, you will freeze. You will freeze, right? And if you haven't had an opportunity, I did a test anxiety workshop. Sign up for it. It's free, just like this one. Take it. Laziness. Laziness is the graveyard of many brilliant minds. Okay. And then over-reliance on teachers. I say that in terms of even me. I want you guys to be able to come to me, but the help that I extend you, I want you to be able to take ownership of it. So tonight is about an opportunity of you taking ownership of the possibility to do better. So I truly believe that you can, get your license in the next 6 weeks or less with my NCLEX virtual trainer. If you have not been able to experience it, if you have not taken the free trial, I'm going to take you in there right now. We have in your workbook, Therapeutic Communication. So let's get ready to fill in your information for Therapeutic Communication. Now, as I'm speaking, you're going to be filling in your workbook. Now, you're going to have to pay attention because I'm going to play this video and it's going to continue on. Now, when you purchase your virtual trainer, you will be able to slow down the video, stop it, add the subtitles, but we don't have that privilege here today. So I want you to pay attention and see if it is a learning method that you can appreciate. So here's Therapeutic Communication. Therapeutic communication has a very important purpose because these are going to be strategies that we can use as registered nurses to help our clients express their feelings more effectively. So I like to use the acronym SOLAR, SOLAR. These are strategies we can use. The S stands for sit in silence. It is okay to just be quiet and allow the client to express their feelings. The O stands for observe with openness. The L stands for listen and lean forward. These are both therapeutic actions. A stands for at eye level. It's okay to sit down, look your client in the face, and be at eye level while you're listening. And then the R stands for relax and also rephrase what the client is saying. Now, these are things that we don't do when we're trying to be therapeutic. The first is give our personal opinions. Even if the client asks you, would you have this procedure? What do you think I should do? Would you take this medication? Those are big no-nos. Don't give your personal opinion about their situation. The second thing is changing the subject. Third is false reassurance. False reassurance is saying things like, if you do this, you'll feel better. Or don't worry, everything will be okay. Those things make the client feel like you don't really care. Next up, we have arguing with the client. It may be easy to fall into this trap, but don't do it. And also, using words like bad, good, wrong, or right are non-therapeutic. On NCLEX, we choose to do these things. And the first is never ask why. Never ask why a client is doing something, why they feel a certain way. We just don't ask them that. Also, when you're being therapeutic, never promise that you won't tell anyone, because as registered nurses, you do have a responsibility to include other healthcare professionals in some areas of the client's care. So, on NCLEX, let's look for, number 1, open-ended questions. 2, answers that focus on the feelings. 3, answers that reflect or rephrase what the client is saying. Remember, when you use therapeutic communication, it allows the client to really make their own choices. So the next part of my therapeutic communication, I want to focus on medications. And I want to look at the digoxin parameters before we move on. Now, the digoxin parameters have to do with when to hold the medication. You can give digoxin at any age group. So you have to take an apical pulse for a full minute before you administer it. So let's talk about what the hold rate is of the heart. So for newborns, if the heart rate is less than 100, then you hold the digoxin. For 1 to 3 years old, if the heart rate was less than 90, then you hold the medication. 3 to 8 years old, if the heart rate less than 80, then you hold the medication. And then 8 to adult, if that heart rate was less than 60, then you hold the medication. More therapeutic communications, we're going to look at our important drug, antidotes. Antidotes can also be called reversal agents on NCLEX, but they mean the same thing. So we're going to look at the medication and the antidote. The first medication, magnesium sulfate. The antidote is calcium gluconate. Insulin is glucagon. Heparin, it is protamine sulfate. For methotrexate, we have leucovorin. And for warfarin, you can have vitamin K or fresh frozen plasma. I want to leave you guys with the needle information. Yes, as registered nurses, you will be given a mini injections. So I want to talk about the 3 different kinds, the subcutaneous, the intradermal, and the IM. We need to know the skin layers that are penetrated, the gauge of the appropriate needle, and that length. So looking at the subcutaneous injection, the skin layers that are penetrated are first the epidermis, then the dermis, into the subcutaneous fat. So you have 3 there. The appropriate gauge is 25 gauge, and the length is 5/8 of an inch. Next, we have the intradermal. When you do an intradermal injection, you go through the epidermis and into the dermis. The gauge is 25, and the length is 5/8 of an inch. Finally, we have the intramuscular injection. The skin layers penetrated are the epidermis, through the dermis, through the subcutaneous fat, and into the muscle. The gauge required for an IM injection is 22, and the length is 1 inch. Great job, guys, on therapeutic communication. Let's keep going. Yeah, so awesome. That was a featured lecture from my NCLEX virtual trainer. And honestly, that is where I keep the best of my content. It is a comprehensive review. You have a workbook just like we did tonight. So if tonight was beneficial for you and you need accountability, that virtual trainer is going to give it to you. You got a daily study calendar, the workbooks I'll send to you. And right now, because we are celebrating International Nurses, we're doing free global shipping anywhere. And as well, we have discounted the VT package, not $50, not $100 off, but actually $140 off of the normal price. And so if you are ready to get serious and get studying, start tonight. You can go right to remarnurse.com. You don't need any coupon codes or anything. Just take advantage of this opportunity. And if you are still wondering if this will be helpful for you, I have another sample lecture. We're going to talk about diabetes insipidus and SIADH. I promise you, in 6 minutes, you will never forget the difference between these two. Most nurses working don't know the difference, but my Remar nurses who are in my virtual trainer, they know the difference. And you got to know the difference in order to be a successful, safe nurse. Diabetes insipidus versus syndrome of inappropriate antidiuretic hormone should really be an advanced clinical topic because most nursing students really don't know the nuances between the two. I find too that most nurses working forget how they are different. So let's start with this. Both are a problem with the antidiuretic hormone. Both are a problem with ADH. So what does the antidiuretic hormone do? Can you think about it? Let's look at it like this. When you have a diuretic, what is the function of the diuretic? What does diuretics tell the body to do? They tell the body to get rid of water. So if we have something that's anti-diuretic, what is it going to tell the body to do? It's going to instruct the brain to tell the rest of the body that we are holding on to water. We are retaining fluid. So both of these conditions will be a problem with fluid in the body. Now, let's look at diabetes insipidus first, because we can learn a lot from just the name diabetes insipidus. So when we see the word diabetes, what do we think of? Most of you all will say we think of high blood sugar. We think of hyperglycemia, but that is not what diabetes means. The word diabetes means a person who is putting out a lot of urine. That's what it means. It means a person who's putting out a lot of urine. The term after diabetes will describe what that urine looks like. So here we have diabetes, somebody that's putting out a lot of urine, and we have insipidus. The term insipidus means clear, colorless, odorless, tasteless. Because remember, back in the day, doctors used to drink urine to determine what kind of illness a patient has. So diabetes insipidus used to be called water diabetes as well, because the urine looked like water. But it is a problem with too little ADH. So you don't have the antidiuretic hormone in the proper amount, telling the body to keep water. So it just puts it out. It just puts out all the fluid because there's no antidiuretic hormone there. So when you think of diabetes insipidus and the signs are severe dehydration. Yes, because somebody with diabetes insipidus has a very high increased urine output. So the urine output can actually be up to 30 liters a day, which is a lot of urine. Also, because the patient is so dehydrated, they're going to be thirsty. They're going to be complaining of thirst. Now, critically think here. Somebody with diabetes insipidus that's putting out a lot of urine, is their blood pressure going to be high or low? What do you think? Is the blood pressure going to be high or low? The blood pressure is going to be low. So what is the heart rate going to do to compensate? The heart rate is going to increase. So you will have those two vital sign changes. But look at the signs again. Do we see hyperglycemia anywhere in diabetes insipidus? Do we expect the blood sugar to be high? No, not at all. So that's why it's so important for us to study the content, because on the exam, I'm telling you, hyperglycemia will be a choice there to determine if you really know what you're talking about. All right, so diabetes insipidus has nothing to do with blood sugar ranges. So what is the treatment for diabetes insipidus? What is it? Because the client does not have enough of the antidiuretic hormone, we need to supplement what is supposed to be there. So we need to give a medication that's going to act like the antidiuretic hormone. Do you know what that medication is? It is vasopressin. Vasopressin. Yes, vasopressin tells the body to hold on to water. It's really good to also improve low blood pressure. So if you plan to work in the ICU where patients have problems maintaining their blood pressure, vasopressin will be a very popular medication for you. Now that you understand when you have too little ADH, let's look at syndrome of inappropriate antidiuretic hormone, where you have too much of that antidiuretic hormone. You have way too much. So it is telling the body that we're going to save all of the water that we have. We're not going to put out any fluids. So the signs of SIADH are fluid overload. Of course, fluid overload. Also, oliguria. Oliguria is very little urine output. Because the client has an increased fluid intake or fluid overload, talk to me about their sodium level. Will the sodium level be up or down? We would expect that sodium level to go down because of the fluid overload in SIADH. Now with diabetes insipidus, we would expect that sodium level to be way high because the patient is dehydrated. But here, low sodium level. So with the low sodium level, we're also going to see a client that is confused. Yep. So you guys know the condition SIADH now. Tell me the treatment. What is the treatment for somebody who has too much fluid in their body? What are we going to give them? We're going to give them diuretics. Yes, we're going to give them diuretics. And specifically, the osmotic class of diuretics is going to be best because that's going to help pull water off of the brain too as well. Also, we definitely would want to put these clients on fluid restrictions. So you have this whole page filled out, and now you understand the difference between diabetes insipidus and SIADH. Thank you for studying with Remar. We're going to keep making it simple for you guys, and we're moving on to the next topic.
My name is Jay and I'm from California, and I'm so proud to be sitting here to tell you guys that today I am officially a licensed nurse, and I never thought that I was going to be able to do so. A few years ago, I finished school in 2015 from the LVN program, and I took the test once and I did not pass, and I felt so discouraged, and I didn't understand why I did not pass. And it wasn't because I wasn't smart in class or anything like that. I just didn't know how to prepare. I didn't know how to study. And when I failed the test, like I said, I just felt so discouraged and I didn't want to try again. But a friend of mine who also is a REMAR nurse, she said, hey, I know this wonderful program. All you need is to do this. And in 6 weeks, you're going to be so prepared, so comfortable. You can do this. And I was kind of, like, no, I don't think so. But guys, if you're watching this, I'm telling you, I promise you, I am not paid to say this. Like, I was a little worried about even doing this because I didn't want people to know that I had failed, because I was, never told anybody. I just took it, I failed, and just said whatever. And another friend of mine, we decided together that we were going to do it together, and we ordered the virtual trainer. Yes, this virtual trainer. And please excuse this book, because I wore this book out. This is my quick facts book. Oh my God, I studied this book so much. I call this the nursing Bible. Okay, so I don't know if I can really open it like that, but as you can see, I studied so much from this book. It is not even a huge book. It just looks like that because I kind of, been wearing it out. But this book right here saved my life. It was so simple, so straight to the point. I felt like, why nursing school couldn't be this? Why this couldn't be the nursing school, okay? And then the virtual trainer, if I could just kind of flick through it a little bit, as you can see all my highlights in there. When I tell you guys that when I sat down for my NCLEX, yes, I was still nervous, but more so anxious just to get it over with. But when I sat down in front of that computer, I heard Regina's voice in my head telling me, that's not the answer. Let's break it down. Remember that core content, because she's going to give you that core content. I'm so thankful for her. Regina, thank you, and your husband for making this program, because it's not just for new grads, it's also for people like myself who didn't believe in itself. And you definitely helped me. And my life is going to forever be changed. My son is getting ready to go off to college. Yes, I'm a mommy of a college kid. And I can now reassure him that I can take care of him. And I am also looking forward to going back to school, and I will be using REMAR again to get my RN license. Thank you, Regina, so much. Keep doing the wonderful job that you're doing, and you're a blessing. You are an angel here on earth, and I just want to say thank you. So look, if I can do it, you guys can definitely do it. Me and my friends, we are both retakers of the test, of the NCLEX, and we studied using this. And we are both now nurses. We both passed. We did it. So that's my time.
Hey everyone, my name is Rashina Cheatham, and I recently took the NCLEX PN, and I was successful. I passed my test. Thanks to REMAR Nursing, Mark and Regina, they are amazing. The biggest thing I like with their program is that they are spiritually based. And since I believe that with God, all things are possible, and so do they, I knew that that was the right program for me right off the bat. So with this program, I got my virtual trainer and my quick facts book, and I used it diligently for about a month straight. Really, I subscribed for 3 months, but for about a month straight, I used this program. I was in my book like no other. I was writing, I was taking notes, I was listening. I was really doing what I needed to do. Also with the quick facts, it was like my Bible. I took it everywhere I went, and it paid off. I was successful with the full 145, but I made it. I passed, and I was a repeat test taker. I took it in November. I had a lot of things going on, and I think I just wasn't focused. But when I really buckled down, I got the Remar review and the quick facts. I was determined, and with the encouragement of Regina and Mark, words can't describe how happy I am and how thankful I am, and how I just know now that life is about to change, and I'm forever grateful for that. So I just encourage every nurse that has taken the test, maybe never taken the test, or going to be taking the test, just know that you can, you will, and you must pass the NCLEX, and it's worth investing into this review, because when I tell you it's amazing, I mean, I felt so confident. I felt like I knew I could do it. I mean, I can't even describe it. It's worth it. So I just want to say thank you from the bottom of my heart. And I can, I will, and I did pass the NCLEX.
Hello everyone. So I am doing this video to let you guys know that if you are debating on whether or not you should use Nurse Remar, I am telling you for myself, you should. I took my NCLEX June the 8th, 8:30 that morning, and I found out the next day that I passed NCLEX. Yay! I have studied these two books front to back. And like Nurse Remar said, if you know these books front to back, you will be okay. I started my virtual training, and I will look at it every day. Even on days it says take a break, I didn't take a break. I was just so anxious to learn. I feel like majority of all the questions that were on my exam came from these two books. I really felt like it. I'm not going to say it was an easy exam, but it was challenging, and I did it. And I know if I can do it, you can do it. These are great books. They are so helpful. They are straight to the point. I have been all in these books. Something different that I did, if I was in the quick fact book and I seen the same material or the same subject in this book, I would pretty much just go to this book and add on to it and, just match things up. So for example, if I see a medication in this book, I would pretty much just go back and forth in this book and just pretty much just add on to it. These are two great books, and I really recommend Nurse Remar. Something she said that stood out was don't use multiple resources, and I feel like that is so true. I know at times a lot of people go back and forth between hers, Remar, Kaplan, Archer, things like that. But I think that you should get one good resource and just stick with it. So for those of you who are hesitant, I was hesitant at first because I was like, oh man, it's so much money. I don't know, blase, blase. So then I've been watching her videos on Facebook. And then one day at the blue, my aunt, she was browsing Facebook as well. And she sort of sent me one of her videos. So I was like, okay, this is Nurse Remar. I've been watching her. Maybe this is my cue, maybe this is my hint to go ahead and just buy it and just trust it. And I'm glad I did. So I purchased the Remar. I did the quick fact book. I did the virtual trainer. I looked in it. I went front to back to front, made sure I knew the material. And I took my test and I passed. And look now, everything happened so fast. I am officially an RN. So if anybody is second guessing themselves, don't even worry about the money. Just pay it. Some people, if you have jobs, they'll reimburse you back for the NCLEX review course. So I would say, yes, use Nurse Remar. You will not regret it. I promise you.
So our repeat test takers are having phenomenal success. And that's why I'm super excited about this program and offering the amazing discount tonight. Take advantage of it. There's 2 months left in this year. That is 2 months for you to get your nursing license. Are you going to go into 2022 without a nursing license, studying for NCLEX? Don't bring in the new year with this over your head. Get your license. You can get it 6 weeks or less. Take advantage of it right now. Free global shipping, no matter where you are on this planet, whatever country you're in, we will get the products to you. And the virtual trainer, again, the benefit of it is this. All right. The lectures are straight to the point and easy to understand. You guys know how I like to teach. It will challenge you. It will give you the accountability. That daily study calendar, some of you guys, if you just get that calendar in front of you, you can go. You just need the direction. And so I'm challenging you guys to make the investment in yourself. It always will return tenfold if you invest into yourself and your education. Let's make it easy. Let's make it easy. Get the virtual trainer, guys. I can't wait to see your testimonial video. If you're the next testimonial, say, I am next. Remember, guys, our nurses are passing NCLEX because they believe I can, I will, and I must pass NCLEX. They say it all the time. I'm telling you guys right now, you can, you will, and you must pass NCLEX. See you guys later. Thank you for an amazing critical thinking workshop. I really had a great time. And I appreciate all the success and the testimonials to be shared. Bye-bye.